Good Friday afternoon. I'm Charity Menefee, Director of Communicable and Environmental Disease and Emergency Preparedness at the Knox County Health Department. Our moment of gratitude today is dedicated to organizations such as Visit Knoxville and the Knoxville Chamber and our entire business reopening team. The individuals in these groups have been instrumental in providing guidance to individuals as they navigate through managing and operating their businesses safely during the pandemic. This team has been a sounding board for feedback, questions, and concerns, while continually providing education and clarification when needed. So thank you to them. As a reminder, the next Board of Health meeting will take place next Wednesday, July 15th from 5 to 7 p.m. via Zoom streaming. The public can watch the meeting live on Knox County's YouTube channel or the Knox County website. Now we'd like to take a quick minute to make a note about testing at KCHD. Due to the volume of people wanting to be testing, we are experiencing long wait times, sometimes more than an hour. Our team is working as quickly and as efficiently as they can, testing well over 400 people a day at our one location. So we ask folks to please be patient. If you're coming to KCHD for testing, please bring water while you're waiting in line. And you can bring a lawn chair to sit on if you want. And remember to physically distance and wear a mask. And as a reminder, a negative test result is just a snapshot in time. While testing is critical to identify and break the chain of transmission, it does not prevent you from getting the virus. This, your mask, the 5 core actions, all of them together are prevention, not the test. If you want to be tested, we encourage you to do so. But please remember that a negative test does not mean that you are immune to the virus. And now we'll move into the local situation. We have 1,526 confirmed cases of COVID-19 in Knox County. Additionally, we have 43 probable cases. 808 of our cases have recovered, giving us 708 active cases. Due to an issue with reporting hospitalization figures, we are refraining from publishing updated data until that can be resolved, and we can be sure of the accuracy in our numbers. Because of that, hospitalization data, including the chart, detailed hospitalizations rates chart, will be updated as soon as we can, but likely won't be until next week. While we can't report Knox County hospitalizations for today for Knox County residents, for the reasons I just mentioned, in order to provide some local perspective on the local hospitalizations, we can provide the regional data from the same data sources that we use in our benchmark data. And with that said, we currently have 84 hospitalized cases in our region, and that's the 16 county region with 19 hospitals, and that can be anybody with a Knox County resident or any other county address, but that's what's in the hospitals as of last night's reporting. We are also thankful to report that we have no additional deaths due to COVID or complications from COVID-19, keeping our total at 10. I want to take a few minutes to draw attention to our active case count. At 708 active cases, the virus is more in our community now than it has ever been. We know our hospitalization numbers are trending up, and the number of deaths have doubled from what they were a little more than a week ago. I'm not saying this to scare you or start a debate about the seriousness or legitimacy of this virus. I'm simply telling you what we know. We know COVID-19 is spreading in our community. We know it is sending people into the hospital, and we know that it is tragically cutting short the lives of some in our community. I think we can all agree on these 3 things. That is why we are continuing to encourage everyone in our community to be mindful when they are out in public. Take every precaution to keep yourself and the people around you safe. Knox County is a wonderful place with a reputation for looking out for our neighbors. That's all we're asking you to do now. Wear a mask, stay 6 feet apart, wash your hands, clean surfaces frequently, and stay home when you're sick, or if we've asked you to stay home. You have the power to reduce the spread of COVID-19 in our community, which will likely save lives. We know this isn't easy, and it's hard to see the light at the end of the tunnel, But please know we are all in this together, and that's the only way that we are going to get out of it. I'll now open it up for questions.
Any questions? Please go ahead and submit them into the chat feature now. And please remember to type your name and the media outlet that you're with. First question is from Elise with WBIR. The city of Knoxville said it will start sharing the county's positivity rate each day. Can you please talk about that decision and what the number means?
So they're likely using the numbers that are available on our website, which would have the daily cases and the total testing number that we're providing weekly on the website. We are not doing that because we are very concerned and we very much hold high standards to the data that we are putting out on the website. And as we've mentioned several times before, there's questions in the denominator there. So there's questions from us, from our perspective, in the number of tests that we're seeing that are being put into the system. For example, we know that there are tests that are done in the doctor's office that never go to the lab, and we get those positives, but there's not a good way for us to get those negatives, and we don't think we're always getting those. That's just an example of some of the issues that we see. So we report our testing numbers as a sample of the data. And you can look at what the trends look like, and people can do their math and see if the positivity rate based on those numbers are changing or not. And I'm guessing the mayor's office is going to be doing that. And that's fine. It still will show you some information, but we hold very high standards to the information and the data accuracy that we're putting on our website and want to continue to do so. So that's why we don't do it.
From Claire with WUOT, what guidance have you given the Knox County Sheriff's Office in terms of ventilation, masks, and social distancing in jails?
There's a great deal of information available from the CDC that we shared with the jails early on with the Knox County Detention Facility and have provided that to them. And there's guidance on all of those things about how to appropriately and try to safely protect both the folks that are inmates in the facility as well as staff that are there as well. So CDC guidance specifically that's available on their website is what we've provided them.
From Jeff with WATE, can you elaborate on the issue with hospitalization data? Has something changed?
Not a lot. Nothing's really changed per se, except for our processes on how we've been gathering data. We said we did some process changes this week, and we just had some concerns about the accuracy of the data that we pulled out today. And it's not on how the hospital is reporting to us, it's how we're collecting and pulling the information out of our data. And so we just, again, want to be on the safe side and make sure that we're putting out the most accurate information that we have. And we didn't feel great about it today. So we're looking at our spreadsheets and how we're calculating the information and are working on that over this weekend.
From Elise with WBIR, what labs are you all using to process test results?
It's that specifically for Knox County Health Department's testing because there's a lot of testing being done in the community.
Yeah, Elise, if you could clarify.
I'll talk about us right now. We have several contracts. Our primary for what we're doing in our in-house testing has been AEL lab. We also work with Path Group in some cases, especially when we go out of the building and do testing for cluster situations or that type of thing. And we also always have access for clusters specifically with the Tennessee State Public Health Lab. Those are our three primary labs that we're using right now.
Elisa's follow-up question is, why is the turnaround so quick compared to the rest of the state and parts of our nation?
I think I talked about this a little bit on Wednesday, but I can elaborate a little bit more. So the information that you see on our website is all of the testing information that we have that's coming in. And so it also has the timeframes that we're seeing for those tests that are being done in the doctor's office that never has to go to a lab. So like the Abbott platform that you've probably heard about. That comes directly to us, and those usually we get same day, and that's a large chunk of our testing that we're seeing in the community. And then there's others that go to the labs, and it could be to AEL or LabCorp, Quest, or Integrity. There's a lot of different other labs that it can be going to, and there's variation and delays with those labs. Some right now are experiencing delays. We're seeing delays from AEL. That's why we've said that our testing has taken a little bit more time coming back, but it really varies on when they're able to get their supplies in and their internal lab capacity. So our number on our website for our benchmark data to bring it all back together is a combination of all of that. And that's the average for all of that testing. So it can be same day reporting up to 10 days And that's where we're getting that, that middle ground average number that you're seeing, which I think right now is a little less than 4 days on our website.
From Jeff with WATE, do you have any new numbers on enforcement/education actions against businesses or individuals when it comes to masks or other guideline violations?
We actually talked about getting that, and I did not get it before I walked in the door, so we'll follow up and get that information out to you.
And Jeff, I can tell you that as of yesterday, when we checked this number, we had about 175 complaints of perceived violations regarding masks at businesses. So hopefully that answers your question.
Thanks, Kelsey.
From Elise with WBIR, are you including negative test results in the reporting turnaround time calculation? And if so, how is that possible if you're not sure how many are being conducted?
Yeah, I explained this Wednesday as well, I think. They do come into that play because they affect lab capacity. So positives or negatives do. We are utilizing the numbers that we're presenting to you as our testing numbers. So what we feel confident in, what gets reported on our website weekly for testing numbers, we use the time frames on those, whether they're positive or negative, to get the average testing time frame. Again, that's using the sample. That's what we call it on our website, the sample total testing numbers.
Also from Elise with WBIR, of the 5 recent deaths that you've reported, what date did they die and how long is that lag in reporting?
The reporting of the deaths we're getting as soon as they, as soon as we're notified, we report it the next day, and it's typically same day or day after when we receive those results. And those can come in from the hospitals or the medical examiner's office or the state medical examiner's office. But I can't give you the exact dates at this time because I don't want to mess it up. I don't have it in front of me. You can pull them. We've been reporting them every day that we've known about them. But again, typically it's the day of or the next day, business day. Actually, not even the next business day, the next day.
From Jeff with WATE, the number of new cases being reported went down today, just a fluke, or is it possible this week was just a peak?
We don't know. We need to kind of get some more days and see over time. That's why we kind of do all of our reporting typically, and we look back at a 2-week time period. It also could be there have been lab delays. The governor's talked about them. I just talked about, what we're seeing with AEL. So some of it could be due to that. And I think that's a point I want to pivot to one point that we want everybody to hear is if you've been tested and you're having a delay in getting your test results and you're sick, you're symptomatic, or you've been a contact to a case, you need to stay home while you're waiting. So it's going to be the period that you need to stay home anyway if you have COVID or if you've been a contact. But please don't go out if you're feeling bad just because you haven't received a test result back.
From Alex with News Talk 98.7, we've heard from some nurses that some rapid result testing is more likely to produce a false positive result. Do you have any evidence to support or argue that point?
A lot of folks in the scientific community are looking at the efficacy of all the tests that are being done, including those rapid tests. And there's not a consensus right now. We've seen both ends, to be honest. We've seen where people have received a rapid test and it was negative, and then they got a PCR and it was positive, and we've seen it the other way. It's not frequent on either direction, but it does happen. But a positive is counted as a positive, and we treat it as a positive no matter what. So, because there's no true way to know if that was really a false positive or not when you're doing the investigations and that type of thing.
From Elise with WBIR, we're 1 week in with a mask mandate. How has it gone so far? And do you expect to see it make a difference in our case numbers? And if so, at what point do you think it'll be reflected in the data?
Well, we really hope and we really want it to make a difference in those case numbers. And it's going to take some time to see that. So typically, give it a couple of weeks. We have a 14-day incubation period. So anybody can start showing symptoms within that time frame. And then it takes some time for people to typically go get tested if they've gotten symptoms and wanted to seek out testing. So usually a couple of weeks is when we'll start to know if we're seeing a difference in behavior and activities and all of those things. I anecdotally, when I've had to go out, I am seeing more people in masks, and that's encouraging, and we want that to continue to go up. It's very important, but there's right now a lot of evidence that shows that they do help. And that's from the scientific literature that's out there. That's the consensus that's there right now from the international and the national community that there is evidence that they do help.
Her follow-up question in regards to the mask is how many complaints have you received and how are those handled?
I think Kelsey just reported on the number from yesterday of complaints, and we can get the exact number today back out to you if you want. And it's our normal processes. So if it is a business that we regulate, it goes to our environmental health division, and they follow up generally with education, providing them the guidance and the documents that they need, the signs they need to post. And we kind of follow through our normal processes in that area. And then we are working with city and other partner organizations for areas where they have regulatory authority to follow up when businesses or organizations fall under theirs.
From Scott with Compass, we've heard that FEMA and the CDC have identified Knoxville as a new national hotspot. Have those agencies officially reached out to KCHD about this?
Yes, we actually were notified on Tuesday that somebody from CDC and from ASPR, which is the Assistant Secretary of Preparedness and Response Office in the Department of Health and Human Services, it's a mouthful, ASPR and FEMA were going to be visiting us on Wednesday. And so we had them here Wednesday afternoon, Thursday, and they left today after an out briefing. They did come because of seeing the rapid growth in cases in this area, and that was a concern to them, and wanted to offer guidance and support and hear of our concerns and being able to elevate those directly up to the federal government when they can. So, and it was a very good visit. We spoke with them, and they met with some of our partners as well.
From Brian Hornback, what is a true rapid result test? Is it the minute test or a 24 to 48 hour result test?
There's a lot of different ones. What I've been referring to mostly today are pretty much the Abbott platform, which is a PCR. And I don't want to tell you the wrong time frame, but if you want to look into it, it's mostly the Abbott tests that are being done in walk-in clinics and doctors' offices that do give us same-day results. And those are the ones that we're getting. We get a lot of those.
From Jeff with WATE, about those perceived violations, can you elaborate on that term? Has anyone been specifically cited or educated, or any KCHD workers dispatched to a location to tell folks to mask up?
We'll have to follow up. I'm not sure if we've had any citations or anything like that. I do know that our staff is absolutely following up with the complaints that come in, but to what level, we'll have to follow up and get back to you with that. We're writing that one down.
From Elise with WBIR, for the first time, Knox County is now over the state's disease burden threshold with an average of 10 or more new cases per day per 100,000. What is your comment on that?
You know, it's concerning. I mean, and that's how we ended up with CDC here. That's why, I mean, you heard my comments at the beginning of this briefing. We're worried about it, and we really need everybody to get on board in the community to continue to do the 5 core actions. We absolutely know they help prevent the spread of this disease. And if we want to continue to move forward, we've been talking a lot about how the prevention methods that we're recommending, they're not about just public health or just the economy, it's about both. And so we need to continue to do everything we can to prevent and slow the spread of this disease within our community. So that's where we are today with the growing numbers.
Also from Elise with WBIR, do you work with nursing homes to inform them of visitation guidelines, and how do these numbers change your process?
We work, the nursing homes fall under very specific guidance from the Tennessee Department of Health. Healthcare facilities in general all kind of fall under their realm, and we work at their direction. But we absolutely do provide guidance and guidelines to them based on the Tennessee Department of Health's directions and directives. When we have cases in nursing homes or questions or concerns, there's also processes to get infection prevention specialists to them to help provide guidance, and they're doing testing regularly. All of that is working directly with the nursing homes and Tennessee Department of Health to make sure we're all having a concerted effort there.
All right, looks like Scott and Jeff have a pretty similar question. They asked, will the CDC/FEMA result in any changes to KCHD's response to the pandemic? And if so, what would those changes entail, and what support did they offer?
The changes, we'll have to see what comes. They were just here. We haven't gotten a full report back yet. They just left a couple hours ago. But I think that they are advocating on our behalf to both the state and the federal government of things that that would be helpful for here. I mean, they heard things about testing concerns and needing to have more dependable laboratory capacity and testing capacity and faster testing and all of those things. They heard about a lot of different concerns. So they heard about concerns from our staff and how they're handling stress and all of the concerns that go with working in this environment. It's an emergency that is lasting a long time. Normally there's, when there's a hurricane or an earthquake, not to diminish those, but there's an endpoint relatively quickly for those types of events. And this one, we're going on, I think we're in month 5 at this point. And there's not an end in sight. And so they heard concerns about that and going to be providing us information on those types of things. And then just helping with funding questions and all of those things that we have. So we'll see, but nothing specific I can come back with right now.
From Vincent with the Sentinel, we have had a mask order and closure orders at various phases of the pandemic. What, if any, additional measures remain for the board to implement? What hasn't been tried that might be tried?
Wow, I don't know. That's a good question and a good discussion for the Board of Health. It's going to be their job to talk about that as we move forward through this pandemic and talk about all the different options that we have. Everything from more surgical focus on specific areas of concern and things that we can do there to broader recommendations. They'll be deciding those things.
From Elise with WBIR, last week Knox County reported a few nursing home staff members tested positive. Any update on those or any additional clusters in the county?
I honestly don't remember what we reported on last week, so I don't want to give you misinformation. We have had some cases in nursing homes. You'll see them on the state website, and we typically direct, because we try not to provide a lot of detailed information on clusters, to either the cluster location on the website or to the State Department of Health who's reporting that. But we have seen a few more, nothing large. Not much in residents. It's typically staff members, which makes sense because they're the ones coming and going. Again, working very closely with them to make sure that all of the prevention and methods and safety methods that they can have in place to protect the residents is there as much as possible.
Also from Elise with WBIR, why are the Board of Health meetings moving back to a virtual setting?
The governor's order allowed those to go back to a virtual setting, and we just feel like that's the safer way to have those meetings. We are doing, as we are right now with you all, with this Zoom meeting, we're doing virtual meetings as much as we possibly can because we feel like during this pandemic, that's the safest way to do it, and we'll continue to do so.
From Jeff with WATE, will KCHD present any plans or recommendations to the health board related to the benchmark red lights?
Yeah, we'll have to see, and Dr. Buchanan will make all of her recommendations directly to the board next week.
From Elise with WBIR, have the hospitals had any issues with PPE acquisition?
We spoke with them yesterday, and so far they've said that they're doing well on that. It's always is a concern, and they're looking out ahead. And again, that was one of the things we talked about with CDC, was making sure that we have a reliable supply there as well. But Dr. Gray said on Wednesday as well that they feel like they have an adequate supply at this time.
Any other questions? Please go ahead and submit them into the chat feature now. From Claire with WUOT, the World Health Organization formally acknowledged yesterday coronavirus may be airborne and issued new guidance about ventilation. Does this give you any new concern about jails and any other crowded spaces in Knox County?
It is concerning. We're waiting on all the full guidance to come out from that. They do still also say that the primary method of contact would be, or method of transmission is that direct droplet contact, close contact from individuals. But we are waiting to see on how the guidance changes and is updated, and keeping an eye on it. But going back to mask and keeping social distancing and all those things still do help in that situation. Because again, the mask is to keep the virus that I'm coughing out or talking and spewing out of the air and not circulating. So it should help.
Any other questions? Please go ahead and type them in now. Also from WOT, how many representatives from the CDC were here and when do you expect a report from them?
We had one from CDC, one from ASPR, and one from FEMA, and hopefully in the near future. They are going on another assignment, and so I don't know the exact time frame at this point.
Any other questions? From Scott with Compass, what is the significance of the CDC ask for a FEMA visit?
On one side, I mean, it was very significant to know that that our area was highlighted as an area of concern. I think they said there's 14 of these visits that have happened over the past 2 weeks, with us being one of them. I think that reiterates the message that we've been saying. This is very much present in our community. Our hospitalizations are going up at a rate that we're not happy with. The increase in deaths we've had are concerning, and we really need everybody to get on board. I mean, from all the way from the federal government, they're seeing we need to be on board with those 5 actions to help mitigate this and help limit the transmission of this virus in our community.
All right, last call. Any questions? All right, not seeing any other questions come in. So thank you all for joining us. We hope you have a great and safe weekend, and we will see you on Monday.